You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. With us, we've had him on the program before, Dr. Eklund. Dr. Eklund, welcome to the program.
Thank you, Randy. It's nice to be here.
Now, you brought a lot of photos today. We'll get to as many of those as we can. But for people that don't know your practice, who's coming in for these mini implants? Like, who's the typical patient?
We really don't have a typical patient. Some of our patients may be in their 30s and 40s, and their teeth will start to wear out. They'll start to get loose, bleeding gums. We'll have other patients will come in, 80s and 90s years of old, and they've worked hard, and their teeth just kind of wear, and they wear out. And these patients are not interested in dentures. They want to have something that's attached, that feels like real teeth in their mouth. And we at Potomac Dental Center, our mission is no dentures. Our mission...
You believe that? Nobody should be wearing a denture.
Dentures have a place, but it does not feel the way that a person wants their teeth to feel. And it isn't about teeth. It isn't about implants. It's about people being able to go out, look at a menu, and not just choose something that they think they can eat, or even more importantly, I have a patient that came and described to me how she would go out to a restaurant with her group of friends, and they would all sit down to eat, and they would take turns ordering, and then it would come to her. And she would say, you know, I'm really not hungry. But secretly, she was starving inside. She had a denture.
What, she couldn't eat in front of them or something?
When she tried to use her denture, the food would get all over the place. It was embarrassing. She needed to be in the privacy in her own home so that she would feel comfortable trying to gnaw on something and not really having attached teeth that could bite into something and to tear something that most of us are able to enjoy.
Okay, now we're talking about mini implants, and they're different than traditional implants. You call them the newer implants. They're smaller. They work.
Absolutely, absolutely. They're strong. They're going to hold up.
Is it common where you are that people have dentures?
Randy, it is so common. We have tens of thousands of people in our area. Just in my practice alone, there's a steady stream of patients that are seeking us out because either their teeth have failed, they're loose, they're in pain, they're embarrassed, ashamed of where they are, and they don't want dentures, or they're in dentures and they're not able to function. I have some photos I can show you about how this has not just been implants, it's not just giving back people teeth, but it transforms lives.
You believe it transforms their life?
Without question. It not only transforms our patients' lives, it transforms everyone around them. Everyone that looks at them.
What do you mean by that?
Well, if you're not confident, and you don't want to show your teeth, you become ashamed of who you are. You dress differently. Lots of times you'll gain weight. You start isolating yourself. You just really lose your mojo, so to speak.
All right.
And we see these people come in, and they're unhappy. But we look at them, my whole team is this way. When a patient comes in or when they give us a phone call, we're excited because we know without question that we can help them, that we'll guide them every step of the way to transform their life from a place where they really don't want to be to being able to kiss. Randy, I even had one patient, when we finished with her, she told my assistant this, she's like, now I'm going to go out and have sex. Okay. That's what this is all about. Because she was so
insecure about her teeth.
Absolutely.
Okay.
It's eating, it's laughing, it's about going on vacations. Randy, I have some pictures.
Yeah, let's take a look.
I have a picture here of Jim, a wonderful guy, active guy, a sportsman. He's a farmer. He also has a couple companies. He came in because his wife was tired of hearing him complain about how his teeth were failing and he couldn't eat that steak that he loved to be able to cook himself for barbecues for his family. And I know There was one thing he did not want to have, that was dentures. We talked about some options. He made the decision to move forth, to be able to have fixed, attached teeth. This is the before and afters. You see the other photo, you see a confident, educated person that is ready to take on life. That's 3 days later. In one afternoon, we gave him upper teeth, we gave him lower teeth. We extracted out his failing abscess teeth, and he went home, went to sleep. We'd give him some medication so he would feel good during the procedure. He woke up the next day, and he was planning on being able to maybe start eating some things a little bit, and he looked in the mirror, and he saw his smile, and he was so excited. He brought out his cell phone, and his wife said he couldn't stop taking selfies of himself, smiling, sending them to his kids, sending them to his friends. Then he went out into the community. He was talking to his friends, and they would be like, Jim, did you do something different? Did you whiten your teeth? Jim, did you get your teeth cleaned? And he was kind of amazed because he didn't realize that anyone noticed what his teeth looked like. And he told them, Dr. Rhett fixed me up. He's given me new teeth on the uppers and lowers. And right now, he's taking business cards of our office and handing them out to anyone that will listen to him. He's so excited about how this is transforming his life.
You say they're discriminated against, people with bad teeth.
One of my patients, she would talk about, she worked at school, and her colleagues were now starting to ignore her. She felt isolated. They would talk to her about, why are you angry all the time? Why are you upset? And she wasn't upset.
And she's telling you this on the consult?
She was telling me on the consult how people thought that she was an angry person. And we'll see in a little bit. I have her picture.
Okay, we'll make sure we show that.
And I'm so excited to be able to share her story. But yes, without a question. And one of the big things that people have when they come into my office is they're scared, Randy. They're scared. They're scared because they feel like that I'm going to cast judgment on them. They're embarrassed. They know other people
because their teeth are so bad.
Because their teeth have worn out. They're bleeding. They know that they're loose. They're not smiling any longer. And when they come into our office, we don't discriminate. We celebrate having them in because we know we can give their life back. We have something that we've been able to do for so many patients. I have another patient to share with you.
All right.
A sweetheart of a patient, Isabel. Isabel came into our office. She was 94 years young.
So why would a 90-plus-year-old want to do this?
Because she wants to eat and chew. Her teeth had worn out. I think she only had about 4 teeth at this time. The rest of her teeth had broken off to the gum line, and she's 94. She still wants to eat, and she still wants to be able to have her kids, grandkids, great-grandkids come in where she can be smiley. When you're lucky enough to be in your 90s, people bring your food. She wants to be able to enjoy that.
That's a good point. Okay.
She wants to be able to smile when her grandkids, when her great-grandkids come in.
So these teeth were just hardly hanging on. So what'd you do for her?
Well, in one morning, we extracted out her teeth, we placed the implants, and I gave her permanent teeth that not come in and out. Now, this was in the resin stage, so they were resin teeth, but they were attached. They were something.
So they're never without teeth?
Never without teeth, and these aren't teeth that she's taken in and out.
Let's take a look at the after.
I want to tell you that it was not her driving this decision because she did not want to be a bother. She was getting on with life. She really wasn't happy. She was complaining to her kids about things. But when they would talk about going to the dentist and getting her teeth fixed so she could smile and chew again, she would be like, oh no, I really don't want to bother you with that, trying to be unselfish. And all of her kids came in with her, and they're like, Dr. Rhett, we want our mom to be able to live out her golden years with teeth. There is no reason in this world, in this day and age, that she should have a denture. How is she going to learn to use a denture at this age? She just needs teeth. And that's what we gave her.
That's what you gave her. So these are mini implants. So mini implants work for teeth that don't come in and out, for fixed, or they're just for snap in, snap out?
This is fixed teeth.
So mini implants work for that too?
Absolutely. Mini implants work, and we attach them on porcelain teeth that she brushes, that she cleans.
Really?
She goes to sleep with them. They feel like they're hers
Do they
again.
eat whatever they want, like broccoli or something?
She's able to eat whatever she wants. This patient came to us.
All right.
Done some research, saw some stuff online, saw that we were an office that we're able to give him back teeth. He didn't want dentures. Young guy, and he wanted to be able to eat the things that he chose to eat, not things that dentures would allow for. One of his favorite things to do in life was to, on Sunday mornings, weekend mornings, make breakfast for his wife. Cook the bacon, have pancakes, cut up fruit, but he'd become increasingly more frustrated because he would make these breakfasts for his wife and he couldn't eat the food that he was making. And he'd come to a point where he had enough, and he came and saw us, and in one day, in one morning, we extracted his upper teeth out, his lower teeth out. We put mini dental implants in, and we gave him permanent temporaries. He'll eventually get his porcelain teeth. We have to wait for things to heal before we can give him the porcelain teeth.
But he has teeth that don't come in and out.
Right. Teeth that don't come in and out. Well, when he was done surgery, and he's out in the lobby, and I was out there with some other staff members, and one of my staff members commented on his pretty blue eyes that he had, and his wife was there, and his wife was like, it was his pretty eyes and his pretty smile that attracted me to him in the first place. That's what I fell in love with, and she was really moved that we were able to bring back the man that she had in her thoughts. And I don't think that was just a bonus, because they came in so that he could eat the things comfortably once again. But what they gained out of it was more than just that. They gained that smile back. She was able to now to reminisce about the person that she fell in love with, and it's the same person she looks at right now. Not like they were two different individuals.
He looks very healthy in the after when you compare the two.
Confident, his chin's up. He is ready to go. I have another story I want to get to you that, here's Vicky. She was headed to dentures. She really didn't want something that was going to move around. Vicky wanted to have lower teeth that were attached. She didn't want to have a denture that was moving around, so we gave her an attached denture. But it was more than just that. It was something that brought outside to her
Very nice.
that none of us expected. We gave her back her smile, and she still hadn't looked in the mirror. She came back to the office. My implant coordinator, Susie, sat down with her and, Vicky, how do you like your new smile? I haven't looked. I'm afraid.
Kidding me.
The mirror was handed to her. Well, they look wonderful. She saw it and she started to cry. She now says, where before people were avoiding her grandkids would say, Granny, what's wrong with your teeth? Now she told me that people call her pretty. When she said that, my two assistants started to cry. I started to cry. It was such a wonderful experience. And this is not isolated. This is like again and again. When I say that this is life transforming, it really is. It's in these stories.
Because they tell you it is.
They tell me these stories. They can't contain themselves.
Back to the denture wearers and the people headed to dentures. They're watching this. If mini implants are so good, right? Why aren't they all doing it? Why aren't they all coming in to get their teeth attached to something? Or something that doesn't come in and out?
Because they don't go to visit the dentist. Their teeth had been a source of misery in their life. root canals, bleeding gums, abscessed teeth, pain and misery. And finally, they get to the point in which they make the decision to get their teeth extracted out. And it's a relief. They now don't have to worry about their aching teeth that they had. They have their dentures, and they don't know their options any longer. They're kind of out of the loop. And what I want to be able to tell them is that we can give them not just attached dentures with implants, because many people know that, but we can give them just permanent teeth that do not come in and out, that they brush.
All right.
It's kind of our cry, our battle cry we have in our office, no more dentures.
I'm extremely happy with the results. I had 20 teeth extracted and 20 implants placed in the same day. I feel great. I would recommend anybody I know that's having issues to Dr. Red. It's been amazing, and I'm confident that he would do wonders for them as well.
See, I smiled before with my lips shut, and now I don't think about it. And people say, wow, Ron, you got teeth, they're great.
It's wonderful when you can eat and don't have any pain. I can smile and not have to worry about what my teeth look like.
I didn't feel good about myself. I didn't like to get my picture taken, and now when somebody says, let's get a picture taken, I jump up and go over. Don't wait, do it now if you have to, because your life will be changed forever.
Here at Potomac Dental Center, it's more than just teeth. We give people back their lives.
We see our patients, and we have very affordable options to be able to fit this into a monthly budget. I have great finance team that searches and works to be able to make this happen. They don't know all of their options. Some people feel like that they don't have enough bone. With my mini dental implants, I've been trained to be able to place implants that are secure, that I can attach a denture or,
Yeah, but what if
teeth
you've been
with.
wearing a denture for 20 years? Isn't it true you may not be able to have enough bone, or you don't have enough bone
Not
to
in my
do this?
office. I had one patient that came in, had been to 3 or 4 different offices, and they had told her that she didn't have enough bone. And we put in the implants. We gave her attached teeth, and she's functioning and she's happy today. I have the training. My team has the ability to do these type of things with many dental implants that may be difficult for other types of dental systems to be able to do it without the big bone grafting. Many dental implants are about half the cost.
Of traditional implants?
Yes, they are.
Okay.
One of the big reasons is that I don't have to do extensive bone grafting to be able to get my implants to fit. One reason why it's less in my office is I'm the doctor that sees the patient from beginning to end. You don't get passed around from one person.
So the way it's normally done, and just correct me if I'm wrong, that you go to one doctor that does the surgery, another doctor that puts the teeth on top. You do both.
I do both. And I'm able to make sure that I'm able to give the person the smile that they want. We don't have limiting facts about, well, the implant may not be in the right spot, because I'm the one who did the surgery. I know where I need to place that implant because I know what the patient needs to have when we get to the end point. Like this smile right here. This is Peggy. She's smiling right now, and you can see that her teeth don't even show. She had work done, and this was the result. For with her, we wanted to give her a cosmetic result. So after
Very nice.
talking with her and finding out what she wanted, we were able to give her this smile. And look how she's smiling before. Look at her afterwards. Look how big and natural.
Very nice. Okay, we have time for like 1 or 2 more.
Here's a very good example of what we see all the time. This is Stephen. He was headed to dentures. He didn't want dentures. It was very interesting because he came to my office, and in 3 weeks, he was going to Disney World. And he was just like, he was fed up, and he was like, "Doctor, can you do anything for me? I don't want to go to Disney World like that." He said, one of my favorite things is to be able to spend time with my family, and my teeth have been getting in the way. 2 weeks later, this is the smile that we were able to give him. 1 week after we gave him that smile, he went to Disney World. And not only he went to Disney World with that smile, he told me that now he's able to eat fried chicken again, because that is something that he had missed out. And it was just, and to go more about him, those right there are just temporaries.
But they don't come in and out.
They don't come in and out. They're fixed and attached. When he was in his temporaries, he turned and he told me, Dr. Rhett, you blew all my expectations away. This is 1,000 times better than I thought it would be. He described how he had, and we'll show you the video.
Okay, we have a video. We have a video. Quick clip.
Okay.
So this is him talking about his results. Let's take a look.
I had a major anxiety towards the dentist, and that was all blown away by the doctor here. I've never felt more comfortable in this chair than ever before, and I was amazed at how little pain, even with, I don't know how many extractions there were, but
Over 20.
Over 20, and I felt, that next day I can't believe that just happened to me. I had more pain in this broken thumb or broken finger 2 weeks ago than I ever did up here. It'll change your life, it really will. It'll make you feel more confident to smile, eat better, and I'm not even at the final stage yet, and I feel 1,000% better than I did 2 months ago, 2.5 months. It's probably one of the better things that have happened to me in the last 20 years, minus my kids,
So this is common.
This happens every day in our office. Here's Victoria. She's a no-nonsense individual. She had her teeth extracted someplace else. She was given dentures. She was not the type of person that was going to live a life with the dentures. She couldn't tolerate them at all. She had her dentures in her hand. This is how she had been. She had been living a life without anything, and
so these are mini implants we're talking about.
We placed many implants in, and we gave her fixed, attached teeth, uppers and lowers. Look at the difference right here. Look at the before. Look at her smile. Total transformation. Next patient I need to show you. This is Donovan, a sportsman, fun-loving individual, but his teeth had worn out. He was headed for dentures. Donovan doesn't want dentures. Here's Donovan now. Look at him smiling and
so
laughing.
Those don't come out.
They do not come out. That is fixed. Donovan, being a sportsman, he liked to go out and hunt. One of his things is that he wanted to be able to eat meat, things that you just couldn't do with partials. He wanted to be able to chew the things and not be limited by his teeth.
Okay, time for one more.
Another patient headed for dentures. She had disease. Some of these patients, things don't even smell right anymore. People can tell that there's problems around them. Here she is now, and one day we extracted out her uppers and lower teeth, and we gave her permanent teeth.
That's a pretty smile. These look real.
I have more.
Okay. It's like you're showing me baby pictures.
Here's another patient that came in. She did not want to have dentures that moved around. We gave her dentures that snapped in. And here she is, and one day we extracted out her remaining teeth that she had, and we gave her dentures that snapped in,
and
that
she
were
could
secure.
Eat and chew still things?
Eat and chew the things that she wanted.
Like you said,
that is a smile.
You have to force them to smile sometimes for the photo?
That is the smile. Case after case that you see here, what we're telling our patient is, give us your big smile. And they're trying, they've been taught, self-taught, that they don't want to show their teeth any longer when they smile, and so they're hiding things. And even when they think that they're smiling, they're no longer smiling.
Now, one of the things we should mention that Medicare does not cover this, that even with the best insurance, it's not going to cover the whole thing.
But we have financing. I have a dedicated implant coordinator, Susie, that will find options that will make it affordable for our patients.
Okay, good. I want to thank you for coming on the show. Final message. Somebody watching this, they're still scared, right?
Come to our office. This is something that we have done for many patients. We can do it for you. People again and again say they wish that they had done it sooner. If only they had done this sooner.
God, well, thank you for coming on the show. Coming back, I should say. So if they want to go to your website, find out more, and when they make an appointment, do they get to see you on the first consult?
Yes. We will walk you through every step of the way. I'll be there with you. I'm the doctor that you're going to see throughout the entire procedure. There won't be anyone
And there's
else.
sedation. We haven't even talked about sedation during this procedure.
Sedation. Many of these patients chose sedation. Others didn't. A lot of people have a lot of anxiety. And as Stephen said, we blew that all the way. After this procedure, they're so comfortable of coming to our office. We're just so excited. Please, you can have something better.
So get a consult. Know your options.
Get a consult.
All right, I want to thank you for coming on the show. Great enthusiasm, and we'll have to have you back. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
I'm extremely happy with the results. I had 20 teeth extracted and 20 implants placed in the same day. I feel great. I would recommend anybody I know that's having issues to Dr. Red. It's been amazing, and I'm confident that he would do wonders for them as well.
See, I smiled before with my lips shut, and now I don't think about it. And people say, wow, Ron, you got teeth, they're great.
It's wonderful when you can eat and don't have any pain. I can smile and not have to worry about what my teeth look like.
I didn't feel good about myself. I didn't like to get my picture taken, and now when somebody says, let's get a picture taken, I jump up and go over. Don't wait. Do it now if you have to, because your life will be changed forever.
Here at Potomac Dental Center, it's more than just teeth. We give people back their lives.